Coming up today, laser therapy, treating a condition that's common after menopause, a topic that shouldn't be taboo, especially when it impacts your health. Plus, springing forward and sleep health, tips to make the time change less troublesome. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Today, we are focused on a topic that's often kept private, and because it's rarely talked about in public, there can be a lot of misinformation. We are talking about menopause and how it affects women down there. I might as well just break the ice. We're going to be talking about vaginal health today, so if it's too much for you to handle, we get it, we understand. We'll just catch you next episode. But hopefully today we can shake off some of the stigma surrounding menopause. In a few moments, we're going to be learning about a laser treatment that aims to give women their sex life back. And in certain cases, patients have no other treatment option. But first, let's get to our morning rounds today. It is that time of year where most Americans will lose an hour of sleep. Daylight saving time starts Sunday, which means many of us might feel a little groggy come Monday morning. So to help us out with that, we are talking with Dr. Nancy Stewart, a sleep medicine specialist here at the health system. Dr. Stewart, good morning. So glad to have you with us. I kind of forgot that this was coming up. It always sneaks up on us. But one of the main things that we hear about good sleep hygiene is that you should set a schedule and stick to it. But then here comes daylight saving time, and then it kind of gets disrupted. What can we do to make springing forward a little bit easier?
You're exactly right. The one thing that I would recommend, in addition to sticking to a regular schedule, is stick to the same wake up time every day. The wake up time is so important. And I know that everybody just kind of reaches over and wants to hit the snooze, just hit it one more time, one more time, one more time. But if you stick to the same wake up time every morning, even on the weekends, that will really benefit you down the road.
All right, easier said than done, but thank you for the tip. I'm going to try it because I'm kind of the snooze queen, and I'm sure a lot of people out there are too. So come Monday afternoon, is it a bad idea to take a nap?
Yes, because what happens when you nap, I tell my patients, naps are like snacks. Snacks aren't good for our waistline. Naps are typically not good for our brain. There are a subset of people that do need naps, and I'm not talking about those folks. I'm just talking about everybody in general. Naps are not good because what they do is they chew up our melatonin levels in our brain. And our melatonin levels need to be at a certain level for our brain to say, hey, we're tired, it's time to go to bed. But if we take a nap in the afternoon or noontime, late afternoon, something like that, what we're doing is we're chewing up those melatonin levels. So we're essentially lowering that melatonin level and taking longer then for the brain to get back up to that peak where it needs to be to tell the brain, hey, I'm tired again. So what you do if you take naps is you're essentially pushing your bedtime later into the night because it's going to take longer for you to get tired. Does that make sense?
It does, because that's what forces the snooze button to be hit come 6 a.m. So I'm betting I know your answer to this, but if it were up to you, would you put an end to daylight saving time?
Oh my gosh, yes. Yes. And I think that so many in the American Academy of Sleep Medicine are working so hard to get this accomplished. In fact, I think in California, they've recently passed something or it's on the ballot. But I know that there are so many of us that are trying to get rid of this because it's just, there's really no reason for it anymore.
You're the sleep expert. What are some of the do's and don'ts? What's your biggest thing that you make sure you stick to when it comes to your sleep hygiene?
Oh my gosh. Well, so sometimes I have 3 little kids, so it's easier said than done. That's number one. Number 2 is you can take 2 steps forward in your sleep hygiene and you'll sometimes take a step back, and that's okay. Give yourself grace to try and change things because in sleep medicine, a lot of it is behavioral change, and behaviors don't change rapidly. So but keeping a consistent wake up time is so, so important. And with my young kids, I really try and limit electronics and limit TV within an hour of bedtime because you really want that last hour to kind of slow down, get ready to go to sleep. Ideally, if you can make it 2 hours before bed, but many folks don't. Many folks are up working late and you know, that's one thing that they can't get rid of.
Yeah, it is. It's tough these days with phones and all sorts of sensories going off, but we will try and take doctor's order. Dr. Stewart, thank you so much.
Coffee's
yeah.
not a bad thing. I'm not advertising, but coffee's not a bad thing.
Okay, yeah, don't take our coffee away from us. That you cannot do.
No. Nope, I won't do it. You know your own body limits, though. Most people can tell, they can't have it past 3 or 4 p.m. because they can't fall asleep at night. Most people, or, they want it, either can't take it past noon or they can't fall asleep, things like that. So it's up to your own body. There's not a hard and fast rule on that one.
Good. Some good news to end on. Dr. Stewart, thanks so much.
Thank you so much.
Well, menopause, it is inevitable, and most women expect something to change once their ovaries stop producing hormones. But what changes are worth seeing a doctor for? And what treatments can help with symptoms, specifically symptoms down there? The medical term is genitourinary syndrome of menopause. We're going to call this GSM today. GSM can have a lot of different symptoms. And to help us understand, we are joined by Dr. Danielle Stacker. She is an OBGYN here at the health system and a certified practitioner for the North American Menopause Society. We'll also be hearing from one of Dr. Stacker's patients, Diane Little. Diane, first of all, just thanks for being here and willing to talk about something so important. And we appreciate you sharing your story. So Dr. Stacker, just help us understand this term GSM. I'd never heard of it. I'm sure a lot of people even going through menopause have not heard of it. Educate us on it.
Okay, this is what occurs naturally in the body as women age. The vagina, the bladder, and the outside genital area is very dependent on estrogen. And when your ovaries begin to stop producing estrogen, that tissue goes through some changes. You lose collagen, so the vagina is less stretchy. The mucosa becomes very thin, nerve receptors very close to the surface. People can experience pain, dryness, pain with sexual activity, recurrent urinary tract infections, bladder leakage, and bladder urgency.
So how do you differentiate between kind of quote unquote normal symptoms of menopause, some of the things you just described, and then something that you really need to take an extra step and come see you?
I think anytime you're experiencing those symptoms and pain, it is a good idea to reach out to your provider.
So Diane, what symptoms were you feeling?
Well, I was a little different. It was not a sexual thing. I was diagnosed with lichen planus, and I had urinary issues. So I did have some of them, a lot of UTIs. And I learned about Dr. Stacker before she was even allowed to do the procedure of the Mona Lisa. And I think I waited 9 to 12 months for her. Another doctor she worked with knew about her and knew she was trying to process it through KU, which thank God, KU approved it. But not only did they approve it, they approved it in keeping the price lower than a lot of places. And so that has been very helpful to me because you do it multiple times.
I do want to ask you, though, how your symptoms were impacting your daily life.
Okay, if you can just imagine a really bad itch down there, because mine was all vulva, mostly vulva issues. You can't go out in public and scratch. And I mean, come on, guys, in baseball, we see that, but you don't usually see a woman doing that. So I was at home a lot. I couldn't use certain toilet papers, so if I was out, I was carrying my own toilet paper. I was just being very careful. I could only use one soap. Everything got down to just making it as less of an issue as possible. So it involved every day of my life.
Oh my gosh, just when you telling us that you were carrying around your own toilet paper, I think that explains how this was impacting your life. What other treatments did you try, though, before you came to Dr. Stacker?
So I tried the vaginal moisturizers. They tried the estrogen creams. It turned out I was allergic to those, or it made it worse. I don't know if that was an issue with the lichen planus or with the lower estrogen, I don't know, but I just know I had a really bad reaction. And so I couldn't do anything else. There was nothing I could do except regular, I used emu oil at the time, and just something to try to keep it moist down there.
You were just trying different remedies. Yes. Were you doing a lot of research and looking around? What were you finding? Kind of going down the rabbit hole, I would imagine.
You can't research it. You said earlier nobody talks about it. Well, guess what? The internet doesn't talk about it much either, and you don't know what to look for.
Dr. Stacker, it feels like there are a lot of things out on the market, creams, ointments that promise to help with some of the symptoms that you talked about. How do you know where to start with that?
One wonderful internet resource is menopause.org.
Oh, there's a whole website to just menopause.
Just
okay,
dedicated
very
to
reputable.
menopause.
This is where people can go and get really good information.
Correct.
Got
It gives us our national academic guidelines for menopause management.
So did Diane do the right thing where she started with her treatment, going to, I guess, a drugstore and looking, but I'm sure there's a lot of options out there. Where do you start in trying to figure out what's right for you?
So first-line treatment for GSM is moisturizers, and there are products specifically designed for the vagina and for the vulva. The moisturizers with hyaluronic acid in them are the best. They're meant to be used twice a week, and for many women, that's all they need. Second line is estrogen therapy, and this is local estrogen therapy.
And this comes in a cream as well?
Comes as a cream. It also comes as a suppository and a vaginal ring. And estrogen regenerates the tissue and restores a healthy vagina, vulva, and bladder.
Going in down that aisle, I think you're looking at, like, when you go to a sunscreen aisle, there's so many different types, and you're trying to read the label and make sure it's got all the good stuff, not the bad stuff, and all the good stuff. Is there anything when we're reading the labels, when we're going out to look for one of these remedies, that we should make sure that we're seeing on the label?
The ingredient hyaluronic acid is very important. You also want to look on the label and make sure it has the right pH. It needs to be the similar pH to the vagina, which is 3 to 4.5. Those are the two most important things.
Very specific.
Very specific.
You've got to know all your science, I think, the science of down there,
yes,
to really make sure you're getting it right. So we have the estrogen treatment, and then if that is not successful, there's a treatment called Mona Lisa Touch, which Diane mentioned, and she tried. One of our nurses showed us how it works. It's basically a wand used both outside and inside the vagina.
The foot pedal is how the physician will control the laser and when she wants to actually be using it. So she'll press on this. And then the laser itself is this square here, and that's how she can tell where she's treating.
So Nurse Jessie Rohan explained the treatments usually start on the outside, then they switch the attachment, and then it's time to go inside. So
the provider will insert this vaginally, and she'll use these markers, and she'll slowly pull it back, and she'll be using the foot pedal to use the laser as she goes, and she slowly will pull it out and rotate it as she's treating the inside of the vagina.
So Dr. Stacker, how do those lasers help with GSM?
So what the lasers do are make tiny holes in the tissue, almost like a polka dot matrix pattern. And the body, in response to these tiny holes, releases histamine, and that recruits fibroblasts, kind of the builder cells of the body, that start to regenerate tissue. And it makes a healthier, thicker vaginal mucosa. It creates new collagen, and it helps to produce your own natural secretions as well.
So like a facelift for the vagina?
Exactly.
So can like a 60-year-old vagina become like a 30-year-old one?
Yes, just like with a facial, you need to keep up with your moisturizers.
Okay. Hey, it's that delicate skin that your mother always taught you. Always take care of your face. So now we got to go south. So Diane, what was your experience with the Mona Lisa Touch?
Oh, it was amazing. They all told me it may or may not work. There's not a lot of evidence about it, but you do 3 times when you first start. And after the first time, I would say I was about 50% better. And after the second time, I was 90% better. And after the third time, I just celebrated because I haven't had any since. But I do regular ones. And if you're lucky enough to see Dr. Stacker, you listen to her really well, because she'll say something like, oh, you could use another one. And then I'll say, but I'll come in 6 months. And she goes, well, you can do that too. So no, you go back and you go to the one she tells you to go to because you do really need it.
Because she can tell.
She saw it and she knows. but it took me a while to learn to listen well.
So is it maintenance? You have to keep up the maintenance. But after 3, it's usually typically 3, you really start to see it, and that's what happened with Diane.
Yes, it's typically 3 sessions. They're 6 weeks apart. It depends on the individual how often they have to go for a touch-up, but on average it's once a year.
You don't have to carry toilet paper around with you anymore?
No.
Not shopping for creams, or are you happy to use creams to keep things moist?
Yes, I still have to do that to keep things moist, but they don't hurt as much. I'm very careful, like when you asked her ingredients, I'm like shaking my head yes, because those things are important, but I also have to make sure I'm on the ultra sensitive, because there's certain ones that still don't work.
There's always risk with anything, even if it's minuscule. Is there any risk that people should be aware of?
Yes, it's a laser, so it is potential to have a burn from the procedure. So people need to be aware of that. The other thing we don't know, the studies are about 20 years old now, I think the first studies, is we don't know if there's a long-term risk 25 years down the line that we just haven't seen yet.
So what do you hear from patients as far as, we've heard from Diane about why she had it, but what about patients that are coming to you because they want to have a better sex life?
So most of the patients are very happy with it. It's very important that they get a thorough workup beforehand to make sure that it's only GSM that is giving them their symptoms, that there isn't something else that's going on. Because if you don't fix another problem that could be causing their pain, they're not going to get better just with the Mona Lisa treatment.
So can someone pick up the phone and find you, or do they need to go to their primary care doctor and then be referred over to you to make sure that this is exactly what they would need?
People can refer directly to me or pick up the phone. I do an assessment before a Mona Lisa is done, because there are some contraindications to it, and to make sure it's going to be a safe procedure for them and that there isn't some other medical issue going on that's causing their symptoms.
You mentioned that this treatment is particularly important for some cancer survivors. How so?
Correct. So certain cancer survivors have a cancer that can be fueled by estrogen. And they absolutely cannot have any estrogen. And if the moisturizers, first-line treatment, don't work, they don't have much of an option. So KU did originally get the Mona Lisa specifically for that patient population in mind who had no other option and wanted to improve their quality of life.
So be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Information is right there on your screen. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Learning a lot today?
Yeah, absolutely. Always good topics here on the show.
Oh, yeah.
Always happy to learn.
All right, how about we just get to the COVID count?
Yeah. So again, a little bit less this week, under 20. We have 18 active infections for COVID in the hospital. A lot better than the past couple weeks. Hopefully that number will continue to go down. As we talked about on Wednesday on Dr. Steitz's show, we had higher influenza infections in the hospital than we did COVID. Hopefully, both of those viruses we will find next week with active infections will be down overall. Obviously, as we're getting into the daylight savings time now and the warmer weather, hopefully the circulation of those viruses will decrease, but we do understand respiratory viral season can go through March into April, and also we know that people will be going on vacations and spring break soon as well, so we'll keep an eye on that.
All right, Hawk. Well, there's actually a connection between COVID and today's topic that we've been discussing. You've seen some research about a surprise side effect of the vaccines, vaginal bleeding. This is even in women who don't menstruate. So how did researchers discover that this was a problem? Yeah,
so abnormal uterine bleeding has been known and even published as far back as 2021. This was a more recent article published in September 2023 looking at abnormal uterine bleeding in those women who don't menstruate, just as you said. So they are looking at premenopausal women or women who are on hormones who aren't menstruating, and then postmenopausal women. What they found was that there was risk of bleeding, especially in the postmenopausal women, anywhere from 3 to 4 weeks after that first or second dose of the COVID-19 mRNA vaccine. Why is this important? Because we know that bleeding can be a sign of other things that are more sinister, like cancer. So this is, they didn't really explain what the mechanism was. The research wasn't focused on that, but just understanding that bleeding can occur in some subsets of women after COVID-19 vaccines is important if they do experience bleeding. So when they go to get evaluated, that may be a question that may be asked by the medical team or the physician when evaluating that bleeding, because we know it is so important to get checked out. So.
All right. Hawk, thanks for the insight
Yeah.
today. Let's go to some questions from our viewers. Dr. Sacker, do you feel there's a stigma around menopause and therefore you feel like it might get in the way of seeking proper medical care?
I think that's changing
Okay.
in America as menopause is out in the media much more. And people should not be afraid to reach out to their provider if they are suffering.
Right. Earlier this week we had a conversation about GI issues, and we just kind of let it all out and talked about it. And I think people are starting to feel more comfortable talking about things that affect everyone. What are you finding? Did you find this easy to talk to your friends about, Diane? I mean, was this something you kind of kept under your hat, or did
Heck
you
no.
ask? You said, no, everyone's going to hear about this.
No. You're telling your girlfriends.
Yes.
If you find a solution during menopause, you're telling
You
everybody.
got to give up the goods, right?
Yes,
Yeah.
you do. I mean, it's a personal requirement.
It's your duty as a woman. If you
Yes.
find something that works, you better to let us all know.
Yeah.
So another question was about checking your pH balance. You said to make sure that you're looking for that on the label and make sure it matches up. How do you check your pH balance on your own?
So pH in a healthy vagina is between that 3 and 4.5. In menopause, pH does go up, and that can contribute to some of the symptoms that we see. In fact, in menopause, it's often above 4.5. Reason for checking pH at home, there isn't very much value in it because there's so many other changes that occur inside the vagina that give people more symptoms.
Can cancer survivors who did not have an estrogen receptive cancer consider local estrogen treatments? Like, can they do them?
Yes.
You can. Okay. What about oral hormone therapy? Jean wants to know.
So oral hormone therapy does go through your entire body. So it does go to the breast and go to the brain and go to the heart and blood vessels. There are some more risks with systemic hormone therapy. When someone is only having symptoms in the genital area, bladder, vagina, vulva, it is recommended to stick with the local therapy because it's so much less risky. There isn't a risk of a blood clot or breast cancer or stroke or a heart attack.
Good to know. Jeremy wants to know, is the Mona Lisa touch covered by insurance?
It is not covered by insurance. It is FDA cleared, but not FDA approved yet. The FDA still wants to see more studies, as I was talking about, what happens 25 years down the line.
Do you think it will always be considered elective, even once it's FDA approved?
That I hope it is covered by insurances.
Question, is GSM the same thing as vaginal atrophy?
Yes, vaginal atrophy is one of the symptoms and changes we see on physical exam that is part of GSM.
Can women who are not near menopause ever develop some of these symptoms and conditions that you've been talking about, like let's say somebody in their 30s or 40s?
So perimenopause can start to occur as early as 35, and where estrogen levels begin to decline. So they may start to notice pain or vaginal dryness or bladder symptoms in their 30s and 40s. The other group of women who have a very low estrogen level in their body are postpartum and breastfeeding women too. Estrogen typically stays very low, and they can develop temporarily symptoms of GSM as well.
So if somebody comes to you and says, I want a better sex life, and thinks that maybe the Mona Lisa would help, do you consult them and say, I don't think that's for you? I mean, it's not just for somebody looking to up their game sexually. It has to be a specific reason to put laser treatment inside there.
Correct. Although there are more and more studies coming out on Mona Lisa in treatment for GSM, there aren't a lot of studies to say if you just want to up your game that the Mona Lisa is going to make a difference.
Okay. What's in the name? Do we know why it's called the Mona Lisa?
It was developed in Italy, and it was developed specifically for the vagina. And they chose Mona Lisa because of the painting.
I think I kind of like it. What about a cream called E-Trace? Do you know much about that?
Yeah, that's a brand name for estradiol cream. Estradiol cream is one of those second-line medications that we use to treat GSM. It has been proven to help.
All right, I want to get to our takeaways today. For folks listening right now, what do you want them to take away, Dr. Stacker, from our conversation?
So please reach out to your provider if you're experiencing any of those GSM symptoms. There's so much available where we can help you and make you feel better.
So treatment has changed so much over the decades.
Treatment has changed tremendously.
Not one size fits all. Diane, what do you want people to take away from your story?
That if when you hear that word atrophy, which was the first word I ever heard, and the doctor says to you, well, don't worry, in 5 or 10 years, we'll do something about it. You walk away from that doctor and you go find somebody who can talk to you about it, because that's what happened to me. And I waited for quite a while until I got really bad, and then I went looking for somebody else to help. And so
keep searching for answers.
Yeah.
And for any women listening to you today, just how important is it to make sure that we are having this open conversation among our friends? Talk to us a little bit about that. Like, why is that so important? And what advice would you have for people to say, don't be afraid to talk about it?
Well, I'm a very researchy type person, except I guess when it comes to myself. And so I'll look up anything that my kids have, but I don't check for myself. And so when I heard those first words and things, it was just another OBGYN appointment. Don't worry about it. The urinary doctor told me the same thing, even though I had started having those problems too. And he was like, the same thing. There's just nothing we can do about it. Here, by the way, try this cream, I think was the comment. And so I did. Of course, it made it worse. So I stopped that. But it was really when I started looking for another doctor. And he's no longer here, but he worked with Dr. Stacker and Dr. Alt. So you've got to tell your friends to keep looking. I still have one friend who I've talked to this about, and she looks at the price tag and she can't make herself do it. And she is still struggling. And I feel blessed that KU keeps the cost down. I mean, I've been doing it 5 years and they've never raised the price. And so that to me is amazing, especially today. I mean, everything jumps 20% with no thought. And I think it makes a big difference when you go in knowing I have to have 3 to begin with.
And it's pretty attainable.
Right.
Thank you so much for talking with us about this and sharing your story. Thank you again to Dr. Stacker as well. And as she mentioned, a great resource for more information is menopause.org. Again, menopause.org, an entire website dedicated with accurate, good information for you to go check out. Again, thank you for watching us today, and we'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update. 4 years into the COVID pandemic, and this shared traumatic experience has changed us. The deaths, the division, and the uncertainty are still taking a toll. I'm Jessica Lovell on the next Morning Medical Update. Mental health experts call it a collective trauma facing society that affects kids differently. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.